Oh, excuse me while I shoot up. This is my IV line, my port. Little tube runs there from my arm into my heart. This is a little saline solution. It's going to clean that port, that line. I put about half of it in here. You see, I've got a little conundrum called osteomyelitis, otherwise known as a bone infection. This one's in my jaw, and for 6 weeks, I'm going to be shooting myself up like this. So how did I get osteomyelitis? Well, it turned out an infected wisdom tooth went sideways, courtesy of really a perfect shitstorm, my nuked immune system. And that courtesy of, in turn, one, I had metastatic prostate cancer, early days, micrometastases, but the cancer has escaped my prostate, floating around in my body, and is incurable, but maybe treatable. We'll get to that in a minute or three. In addition to that, I had 39 sessions of radiotherapy over the course of 6 weeks, which did a number on my cancer, but not a big enough number, and also a number on my immune system. And finally, pandemics and cancer don't mix very well. So I contracted COVID 3 times. 2 of those bouts necessitated a visit to the emergency room. You know, when your physician wife calls an ambulance for you, you're in trouble. Anyway, there I am. So I get an infected wisdom tooth. Yeah, I shouldn't have it at my age, but you know, an outlier in all kinds of ways. It went sideways into my jaw. My jaw swelled up to about the size of a golf ball. It looked like I had a golf ball in my mouth. And I went on the medical treatment circuit, first going to an oral surgeon who removed a couple of teeth in the back that were suffering. Then to ear, nose, and throat specialist who sent me to a head and neck cancer specialist who sent me to an infectious disease expert who said, bone infection, and it's bad. Little bits of necrosis, dead bone in your jaw. And what we're going to need to do, probably, unless things turn out well, is reconstruct that jaw. First we'll try it with a chunk of your leg bone. If that doesn't work, we'll throw in some titanium. If that doesn't work, I guess you lose your jaw. But it turns out this IV antibiotic seems to be doing the trick. I'm only 2 weeks into 6 weeks of this. My house now looks like a crack den because I've got syringes everywhere. You know, and now I've done the saline. Then I did the antibiotic, saline to rinse the line again, and I'm going to add some heparin to prevent myself from undergoing a blood clot that could do further damage to this bald head of mine. Okay, there's a little bubble in there. I don't want that to go in, so I'm going to stop a little short. And now put a little heparin in there. So anyway, as I was saying, I've got this pretty horrible malady. It's really fatigued me. It hasn't stopped me from cycling. I've got 8,000 miles in. This is December 7th of the year. I've got 8,000 cycling miles in. The last ones have been slow because I've been so freaking tired from the infection and also this high level of antibiotic. But there is good news. Yeah, sure, my cancer is metastatic, early days, but I am on the road to getting the kind of treatment I really want. The treatment is called Lutetium-177. That is spelled Lutetium. I pronounce it Lutetium until I went online to learn how to speak it in a more sophisticated fashion. That 177 is the mass, the atomic mass, just a combination of the neutrons and protons. It's not an algorithmic number. For instance, the uranium we worry about is uranium-238, which is much, much more radioactive than Lutetium-177. Lutetium-177 is this radioisotope injected into your bloodstream to attack cancer cells. And this is the way it works. First, you get a prostate-specific membrane antigen PET scan. That prostate-specific membrane antigen is a protein that attaches to the outside of cancerous prostate cells, which are floating around in my body. That PET scan, positron emission scan, is a live scan as opposed to the sort of the still photograph from MRIs or CT scans. It actually measures metabolic rate. And the way it does that is first you get injected with something called gallium-68. Now molecules with an atomic mass of 83 or above are radioactive. So I've got the Lutetium-177, which I want, but first I get the Gallium-68, just barely below the radioactive measure, but hot enough, if you will, that when it attaches to the outside of this prostate-specific membrane antigen, the scan will light it up, and they can see. The doctors can see whether and where your cancer is. So first you get a shot of this Gallium-68, which should light up once it finds the prostate-specific membrane antigen, the outside covering of prostate cells. If it lights up, the docs know that you've got cancer. I'm all done now. That you've got the cancer cells, and can then inject this Lutetium-177 into your body, which attaches to that Gallium-68. Lutetium-177 does this thing called radioactive decay, which means it emits radioactivity, radiation to the cancer cells. It doesn't quite kill them, but does a really good job of preventing their spread and growth. Now, the FDA, Food and Drug Administration of the United States, approved the use of lutetium for prostate cancer in March of 2022, a year and a half ago. But only for castration-resistant prostate cancer. What does that mean? Well, you could actually get the little testicle snipped off if you want. Most people choose a less violent methodology, that is chemical or medical castration, as it's known in the literature, or androgen deprivation therapy. You receive a shot 4 times a year of a drug, typically Lupron, its trade name, that prevents your body from producing testosterone. Prostate cancer cells love testosterone. It makes them grow, thrive, and spread. Take that testosterone away, does it kill them? No. The things are wily and they are determined. So in 2 or 3 years, those cancer cells will mutate so that they don't need testosterone anymore, and they will grow, thrive, and kill you. The medical environment in the United States and the FDA have approved that Lutetium-177 only after that castration stops working. That is, after you've undergone this 2 or 3 years of chemical castration. Once that stops working, you can have lutetium. Well, there are some interesting side effects. We won't go into any intimate details, but I view myself as an athlete, having cycled this 8,000 miles. That's more than 150 miles a week. That's 22 miles a day so far. I've got a couple months left. I could get it a couple hundred more miles easily in 2023. And I'll lose that ability while I undergo this androgen deprivation therapy or medical castration. I don't want to do it. In addition, it turns out that the lutetium treatment is more effective than the hormone therapy and has fewer side effects. Well, can you do it, administer lutetium, before undergoing androgen deprivation therapy? Well, it's not approved in the U.S., although I'm hoping to talk my docs into an off-label use, but it's been done in the EU. And what are the results? Recent studies, the most recent one published a year ago, that is the last day of 2022, small number of study subjects, 24 thereabouts, but still statistically significant, revealed that, again, lutetium has fewer side effects and is more effective than the androgen deprivation therapy. But more importantly, it is more effective if done before the androgen deprivation therapy or hormone therapy. Yeah, the standard of care is going to change. I told a friend who's well-versed in the medical field that I got this disease 5 years too early. He said, John, everybody gets a complicated disease 5 years too early because medical science proceeds. But the standard of care will change. It hasn't changed yet in the U.S. So what am I doing with this? Well, first, I've gotten my providers, the Yale Cancer Hospital, down Smilo, Yale Cancer Hospital in Connecticut, to agree to conduct the PSMA PET scan with PSA numbers lower than usual. That is, my prostate-specific antigen numbers are increasing. I shouldn't have any prostate-specific antigen. That's a protein that prostate makes because I haven't had a prostate for 3 years. It's been increasing. It hasn't reached the level where in the U.S. anybody would authorize typically the use of this fancy scan technique. But because I have this increasing number, because initially my doctor did not get all my cancer, or wasn't told for a year, had a positive margin, and it's the outside edge, what was removed from my body was cancerous. No one told me this for a year. In addition, at that year's point when it was revealed that I had this positive margin, I demanded a decipher test. That's a proprietary name for a DNA test to measure the aggressiveness of cancer. Got a decipher test. The decipher test revealed that my cancer is about the most aggressive flavor possible. So, given that history, that I had a positive margin, and that my cancer was the most aggressive it could be, and it sat there for a year before anybody did anything about it, that is, nuked it with radiation, which didn't nuke at all, my treatment team has agreed to give me this fancy scan, even though ordinarily would not. And I'm hoping to leverage this information and my knowledge of the system and my charming good looks and personality into convincing my team to give me this off-label use of this Lutetium-177 that is administered to me without having me undergo this hormone deprivation therapy. But that doesn't work. The team that conducted that revealed that lutetium works better before the administration of the hormone therapy. The team comprised of doctors in Germany and the Netherlands. They've agreed to treat me so long as I can get a PSMA PET scan here at home. Well, the PET scan's on the way. I'll get it in January. So we'll see what happens. Stay tuned. I need to go find the medical waste bin and carry on with my life. I'll update you as soon as I can about whether I can get this Lutetium-177 treatment in the United States. Take care.